Hello and welcome to our channel. Today we will talk about valvular heart disease. In this video, we'll explore everything you need to know about this condition, including its causes, symptoms, and the latest treatment options available. Whether you or a loved one have been diagnosed with valvular heart disease, or you simply want to learn more about this important topic, be sure to watch this video and stay informed about your heart health. What is valvular heart disease? Valvular heart disease is a condition that affects the valves in the heart. These valves are responsible for regulating blood flow through the heart, and when they are damaged or diseased, they can cause a range of symptoms including shortness of breath, fatigue, and chest pain. There are many different types of valvular heart disease, including aortic stenosis, mitral regurgitation, and tricuspid valve disease. The causes of valvular heart disease can vary, but may include age, genetics, infections, and other underlying health conditions. If you suspect that you may have valvular heart disease, it is important to speak with your healthcare provider to get an accurate diagnosis and treatment plan. What causes valvular heart disease? Valvular heart disease can be caused by a variety of factors, including age, genetics, infections, and other underlying health conditions. Some people may be born with a congenital heart defect that can lead to valvular heart disease later in life, while others may develop the condition as a result of an infection or other medical condition. In some cases, valvular heart disease may be caused by lifestyle factors such as smoking or a poor diet. It is important to speak with your healthcare provider to determine the underlying cause of your valvular heart disease and develop an appropriate treatment plan. What are the symptoms of valvular heart disease? The symptoms of valvular heart disease can vary depending on the type and severity of the condition. Here are some common symptoms of valvular heart disease. Shortness of breath. This is a common symptom of valvular heart disease and occurs when the heart is not able to pump enough blood to meet the body's demands. Fatigue. Patients with valvular heart disease may experience fatigue due to reduced blood flow and oxygen delivery to the body's tissues. Chest pain. Chest pain can be a symptom of valvular heart disease, especially in patients with aortic valve disease. Heart palpitations. This refers to an abnormal awareness of one's heartbeat and can be a symptom of valvular heart disease. Swelling in the legs, ankles, or feet. This can occur due to a buildup of fluid in the body as a result of the heart's inability to pump blood effectively. It's important to note that some patients with valvular heart disease may not experience any symptoms, especially in the early stages of the disease. Regular checkups with a healthcare provider can help to identify and manage valvular heart disease early on. How is valvular heart disease diagnosed? Valvular heart disease refers to any condition that affects the valves of the heart. Diagnosis of valvular heart disease typically involves a combination of medical history, physical examination, and diagnostic tests. Medical history. The healthcare provider will ask questions about the patient's symptoms, medical history, and family history of heart disease. This information can help to identify any risk factors and potential causes of valvular heart disease. Physical examination. The healthcare provider will perform a physical examination, including listening to the heart with a stethoscope. Heart murmurs, or abnormal heart sounds, may be an indication of valvular heart disease. Diagnostic tests. Various tests may be performed to diagnose valvular heart disease, including echocardiogram. This test uses sound waves to produce images of the heart and can detect any abnormalities in the structure and function of the heart valves. Electrocardiogram, ECG. This test measures the electrical activity of the heart and can detect any irregularities in heart rhythm. Chest X-ray. This test can provide information about the size and shape of the heart, as well as any signs of fluid buildup in the lungs. Cardiac catheterization. This is an invasive test that involves inserting a thin tube through a blood vessel and into the heart to measure pressures and evaluate the valves. Magnetic resonance imaging, MRI. This test uses a magnetic field and radio waves to produce detailed images of the heart and valves. Once a diagnosis has been made, treatment will depend on the type and severity of the valvular heart disease. Some patients may not require any treatment, while others may need medications, surgery, or other procedures to repair or replace the affected valve. What are the treatment options for valvular heart disease? The treatment options for valvular heart disease can vary depending on the type and severity of the condition. Some common treatments may include medications such as diuretics or beta blockers, lifestyle changes such as diet and exercise, and surgical procedures such as valve replacement or repair. Your healthcare provider will work with you to develop an individualized treatment plan based on your specific needs and medical history. Can valvular heart disease be prevented? While there is no guaranteed way to prevent valvular heart disease, there are some steps you can take to reduce your risk. These may include maintaining a healthy diet and exercise routine, quitting smoking, and managing any underlying medical conditions such as high blood pressure or diabetes. Additionally, it is important to have regular checkups with your healthcare provider to monitor your heart health and catch any potential issues early on. What is the difference between mitral and aortic valve disease? First, let's talk about the differences between mitral and aortic valve disease. Both of these conditions involve damage or malfunction of the valves in the heart, but they affect different valves. The mitral valve is located between the left atrium and left ventricle, while the aortic valve is located between the left ventricle and the aorta. Mitral valve disease can lead to blood backing up into the lungs, causing shortness of breath, fatigue, and coughing. Aortic valve disease can lead to the heart having to work harder to pump blood through the body, leading to chest pain, dizziness, and fainting. Now, let's address the question of whether valvular heart disease can lead to heart failure. The short answer is yes. When the valves in the heart are damaged or malfunctioning, the heart has to work harder to pump blood throughout the body. Over time, this extra strain can weaken the heart muscle and lead to heart failure. However, not everyone with valvular heart disease will develop heart failure. With proper treatment and management, many people with this condition are able to lead healthy, normal lives. Speaking of treatment and management, let's talk about the prognosis for valvular heart disease. The prognosis depends on several factors, including the severity of the condition, the age and overall health of the patient, and how well the patient responds to treatment. In general, the earlier the condition is diagnosed and treated, the better the prognosis. With modern treatments such as medications, minimally invasive procedures, and surgical interventions, many people with valvular heart disease are able to live long and healthy lives. Finally, let's discuss what lifestyle changes can help manage valvular heart disease. There are several lifestyle changes that can make a big difference in managing this condition. These include regular exercise, maintaining a healthy diet, quitting smoking, and reducing stress. It's also important for patients to work closely with their healthcare providers to monitor their condition and adjust treatment plans as needed. And there you have it. The differences between mitral and aortic valve disease, whether valvular heart disease can lead to heart failure, the prognosis for this condition, and lifestyle changes that can help manage it. We hope this information was helpful and informative. If you have any questions or comments, please leave them below. Don't forget to like and subscribe to our channel for more health-related content. Thanks for watching.